Are you bothered by those persistent lines between your eyebrows, often called frown lines? You're not alone. Many adults seek solutions to soften these moderate to severe glabellar lines. A new option, Letybo, has recently been approved by the FDA. Let's explore what Letybo is, how it works, and what you need to know before considering this treatment. Letybo, with the generic name letibotulinumtoxinA-wlbg, is an intramuscular injection. It's specifically designed to temporarily improve the appearance of moderate to severe brow furrows in adults. These lines are typically caused by the activity of the corrugator and procerus muscles. This medication is a neurotoxin. It works by blocking nerve signals to the muscles, preventing the release of acetylcholine, a chemical that causes muscle contraction. This temporary muscle relaxation smooths the frown lines. The effects of Letybo gradually wear off as the neurotoxin degrades and new nerve connections form. This process typically reverses the treatment effects over several months. Letybo received FDA approval on February 29, 2024. While Letybo can be effective, it's crucial to be aware of potential risks. Rarely the neurotoxin could spread beyond the intended injection site. This unintended spread can lead to serious issues like difficulty swallowing or breathing, which may be life-threatening. Letybo is not interchangeable with other botulinum toxin products. Each product has different potency units, and switching between them can lead to serious reactions. Always ensure your healthcare provider knows exactly which product you are receiving. Hypersensitivity reactions are also a possibility. If you experience an allergic reaction, your healthcare provider will stop the treatment immediately and provide appropriate medical care. Serious cardiovascular side effects, including fatal ones, have been reported with botulinum toxin products. If you have pre-existing cardiovascular disease, your doctor will use caution when administering Letybo. The effects of treatment may also be worsened if you have other neuromuscular disorders. Patients with existing breathing or swallowing difficulties should also use Letybo with caution. It is important to note that the safety and effectiveness of Letybo in children have not been established. This treatment is intended for adult use only. Before receiving Letybo, there are several important factors to discuss with your healthcare provider. Do not receive Letybo if you are allergic to Letybo, letibotulinumtoxinA-wlbg, or any of its inactive ingredients. You should also avoid Letybo if you've had an allergic reaction to any other botulinum toxin product, such as Botox, Dysport, Xeomin, Jeuveau, Myablock, or Daxxify. Additionally, Letybo should not be administered if you have a skin infection at the planned injection site. Your healthcare provider will assess your skin before treatment. It is vital to provide your healthcare provider with a complete medical history. Tell them if you have a disease affecting your muscles and nerves, such as ALS, Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome. Also, disclose any past side effects from botulinum toxin products. Inform your doctor if you have or have had breathing problems like asthma or emphysema or swallowing problems. Any history of bleeding problems or heart problems should also be shared. If you plan to have surgery, mention this to your provider. Discuss any weakness in your forehead muscles, such as trouble raising your eyebrows, or if you have drooping eyelids. Previous facial surgery or a history of dry eyes with botulinum toxin products are also important details. Finally, if you are pregnant, plan to become pregnant, are breastfeeding, or plan to breastfeed, discuss these with your healthcare provider. It is unknown if Letybo can harm an unborn baby or pass into breast milk. Letybo is administered by a qualified healthcare provider, typically in a clinic setting. It is given as an intramuscular injection directly into the muscles of your brow line. Your provider will determine the precise injection sites. The treatment should not be injected more than once every 3 months. Your healthcare provider will advise you on the appropriate frequency for your individual needs. The exact dosage will also be carefully determined by your healthcare provider based on your specific condition and desired outcome. After receiving Letybo, it's important to be aware of potential temporary effects. You might experience loss of strength, general muscle weakness, blurred vision, or drooping eyelids. These effects can occur anywhere from hours to weeks after your injection. If you experience any of these symptoms, it is crucial to exercise caution. Do not drive a car, operate heavy machinery, or engage in other potentially dangerous activities. Wait until these effects have fully resolved before resuming such activities. Letybo can cause serious side effects, some of which can be life-threatening. It is essential to seek immediate medical help if you experience any of these problems after treatment. Call your healthcare provider or emergency services right away. Problems swallowing, speaking, or breathing can occur hours, days, or even weeks after an injection. This happens if the muscles used for these functions become weak. Severe swallowing or breathing problems can lead to death, especially in individuals with pre-existing conditions. People with certain breathing problems who rely on neck muscles to breathe are at higher risk. Swallowing problems may last for several months, potentially requiring a feeding tube. If food or liquids enter the lungs due to swallowing issues, it can be very dangerous. Other serious side effects include allergic reactions, such as anaphylaxis. Symptoms like wheezing, trouble breathing, dizziness, or fainting require immediate emergency medical attention. Irregular heartbeat and heart attack, some fatal, have occurred with botulinum toxin products. Inform your doctor about any pre-existing heart conditions. Some individuals have experienced dry eyes, reduced blinking, and corneal problems. If you develop eye pain, irritation, sensitivity to light or vision changes, contact your healthcare provider. The most common side effect reported with Letybo is headache. This is not a complete list of all possible side effects. Always consult your doctor for medical advice regarding side effects. It is crucial to inform your healthcare provider about all medications you are taking. This includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. Certain combinations of Letybo with other medicines can lead to serious side effects. Do not start any new medications without first telling your healthcare provider that you have received Letybo. It is especially important to mention if you have received any other botulinum toxin product in the last several months. Be specific about which product you received, such as Myoblock, Botox, Dysport, Xemin, Jeuveau, or Daxxify. Certain medications, including aminoglycoside antibiotics, anticholinergic agents, or other agents that interfere with neuromuscular transmission, may increase the effect of Letybo. Always keep an updated list of your medications to share with your healthcare provider and pharmacist. For a complete list of interactions, refer to the Letybo product information. Letybo vials should be stored unopened in a refrigerator between 2 degrees Celsius to 8 degrees Celsius, 36 degrees Fahrenheit to 46 degrees Fahrenheit. Keep them in their original carton to protect them from light. Do not freeze Letybo. The active ingredient in Letybo is letibotulinumtoxinA-wlbg. The inactive ingredients include human albumin and sodium chloride. Letybo is manufactured by Hugel Inc.